the Northwest Department of Agriculture's MEC in Madoda Sambatha is currently giving an update on the availability and distribution of the foot and mouth disease vaccine in that province. And this will be followed by a vaccination process at one of the most affected farms in Potchefstroom. That process is underway. Let's listen in.
The nationalists then took up the matter with international bodies and through SABC. Remember, SABC still comes in to approve and regulate. Those that have been approved internationally, dominantly Argentina, Brazil, Turkey and others, are supplying us through national because national procures for everyone and then distributes proportionally. Proportionally means according to the number of impacted provinces, which means if you look to the scale, we are affected, but our infection constitutes 5% of the national infection, which means KZN is expected and receiving the highest number of vaccines compared to us, because the number of infection is very high. You can even check that thing. Gauteng, it's less than half of our total number of cattle we have. We have 1.4 million, they have close to 500,000. But the rate of the impact by the spread is higher in Gauteng than us. Then on the basis of intervention to respond to the spread, Gauteng gets higher than us. Because the first thing you are dealing with, you are not starting with the head as a whole. You're starting with areas where your spread is still active as a basis to intervene to reduce the spread. In that instance, we would get 5% because our spread is 5% on the national basis. But the number, when we are to be counted, we are going to be number 4 nationally on dealing with the whole number of the expected vaccines. Here's the common area here. It's very difficult to impose quarantine measures in communal areas. And this is a lesson where agriculture departments must then learn on how quarantine measures could be possible in the future in communal areas. Because grazing is communal. Access to livestock water is communal. So when one is affected and you impose...
Madoda Sambatha is the agriculture in the Northwest is giving a media briefing about around the interventions in that province in order to curb the spread of the foot and mouth disease. Vaccines, you know, are the big talking point, and several, we're told, will be made available in the coming weeks.